that, do you see a need that we might put our energies toward? Do you see a hole that we might, somehow work to fill? We have some people here with some energy, some desire, some time, but who better to know than people who live there?
Mm-hmm.
I feel like I've got to really mull that over. I don't.
It's not something
What comes to your mind right away?
Well, when it comes to healthcare, I think, there's obviously still some work to be done. When you've got, the Briceville Clinic is morphed into, Dr. Kim's a well-meaning person, but it's more or less a church-run thing. When RAM, Remote Area Medical, which, he's just really good at PR and, getting all kinds of publicity for himself and TV coverage when he can take a crew of volunteer doctors into someplace on the outskirts of Knoxville and pull people in from 50 miles around, for free checkups. Obviously, there's not enough of that being provided, you can talk about improved health care all you want, but if you've got that many people showing up for a round gathering in Roane County or someplace like that, then there's still a whole lot of people who are not getting the kind of checkups they need and the kind of maybe preventive health care that they need, and so I think it's still a problem. And, God knows, and I don't know how you deal with this, but drug education and drug rehabilitation, the whole approach in Campbell County and in the mountains right now is bust them in jail. Bust them in jail and tax and build them. Bust them in jail and tax people and build bigger jails. Don't educate, don't rehab, don't go to the root of the problem. Just get all those drug addicts out off the streets, put them behind bars and let the taxpayers support them. That is not working. Now, how the Student Health Coalition can help, or Vanderbilt or anybody can help, is not something that I'm prepared to be specific about. But God knows it is a problem, and the local officials are not dealing with it. They are not addressing that problem at all. They're failing miserably. And so I think that's another thing that really needs to be looked at, because it is a real problem now in that area. It's become the moonshine of the 2010s.
Yeah, because the hard thing is, what do people in the Student Health Coalition themselves feel drawn to among the things that might be out there to be done? It's a tremendous, drugs are a tremendous problem. When Bill Corr's right here, when Bill Corr was talking about what's going to be needed, just even with the Affordable Care Act, to get the word out, and I respect the Tennessee Primary Care Association's efforts, but one outreach worker in one clinic is not going to get the job done. And what kind of unique community resources can be mobilized? Who has the resources for that? I think right now, maybe no one sufficiently, and that may be part of what the Affordable Care Act does, have some more ideas and provisions about, but so much more is going to be needed, and there's so many people that are going to be left in the cracks in a state like Tennessee, which is not voted for Medicaid expansion. And I think I've heard up to 300,000 people may not be eligible for health services in that crack from who aren't getting Medicaid now up to 138%. That's 300,000 people. So you have these community health centers, but so it just seems to me there are problems, there are holes, there are lacks. What is it that the folks themselves in the Student Health Coalition feel drawn to, feel is in their capability of providing more than what I would identify? There's lots of holes, but I don't think I would go further than that.